So let's pretend perhaps on your lateral gastroc area. Yeah. Obviously, Alicia's fighting fit today, but we've chosen to pretend that she's got an injury because everyone's too fit and well here. The Melbourne and Sydney courses have people limping in here that have fit.
It's soft in the entrance,
yeah. Must be. All right, slide back just a little bit for me now, Alicia. Fine. Yep, perfect. All right, so the first thing we're going to do is take through the calf and the Achilles. So we're assuming here that Alicia's got a calf strain. And I'm assuming here that she's mentioning her soreness is pretty much over the lateral head of the gastrocnemius, so that's going to be our main area that we're thinking we want to assist with some pain. But this technique could be used just to assist the calf function, so it might be that you're just trying to give it some additional support to help the toe actually come up, or the heel come up as you're pushing off, or like we're saying for this case for a calf strain. So the technique is similar to what I just showed you there. For all the applications, you just need to make sure you've rounded your corners and measured. So for this one, we're going to use the 5 centimetre width. It comes in 10 centimetres as well, and I'll show you some variations of how you can use the 10 centimetre throughout the day. But a lot of these, just generally around the clinic, you'll find your 5 centimetre more readily available. So I'll show you that today. But you can cut in half your 10 centimetre if you've only got that, or you can actually cut it along halfway and split it as well for the same technique. Alright, so for this particular technique, I'm going to measure from the top of the Achilles, 2/3 of the way up the calf. Okay. Now we're allowing for some stretch, so by the time we actually stretch it, we're pretty much along the full length of the calf. And I must say, this is probably the hardest part about using kinesiology tape to start with, is just that it's a little bit of a guess and feel until you've used it a bit and you can really estimate roughly how long you need. But what I would suggest is you cut a little bit extra if you're not sure. It's much better to be able to trim it back than not have enough. So I'll pop that in the middle there. So just to save some time, that's okay, Alicia. I'm going to use 2 strips, so I'm just cutting them together just so that we're minimising the time there. So you're going to round your corners on both ends. Now, thinking back to what we spoke about with the elastic recoil of the tape, where it's actually bunching together, if we have the calf muscle on stretch, so if the patient's able to go into a stretch position, so pulling their foot into dorsiflexion, you can visualise that as the tape's on there bunching together, we're actually supporting and assisting the calf. Can everyone see that? Yep, so to assist with the muscle contraction. So what you're going to do is peel your 5 to 10 centimetres back, placing in the centre of the Achilles towards the top part, so that we've got room for a second strip to go onto the inside part of the calf and Achilles. Okay. Now I've just placed that down, no stretch, and remember what we spoke about with the glue is that until you actually warm it up and rub it and actually heat activate the glue, it's not going to stick. Okay, so it's a little bit forgiving if you place it on the skin and then you're not happy with its placement. You can sort of peel it back and put it in a different spot. Until you rub it, it won't set. So then you're going to peel off the backing paper to the last 5 to 10 centimetres. To be honest, if you're not sure, I'd always err on the side of caution, have a longer anchor at each end. Okay, and we're going to go up to about 40 to 50% stretch along the line of the muscle that we're looking after, which is your lateral gastro. Applying stretch and giving a good rub to activate the glue, and then laying the last part of the tape down on the surface of the skin. And you can probably actually see those people closer. You can actually see the weave of the cloth there where it's on the stretch. Now if I went to maximum stretch, she's got nowhere to go from there, okay? So it's actually going to turn into more of a restrictive tape rather than an elastic stretchy tape, all right? So just be careful. With all of these techniques, you're not trying to actually maximise the stretch. In fact, for most of the techniques, I use about 40 to 60% stretch, and that's just by feel from practice, so finding the maximum and then coming back a little bit. And then for other techniques, more for lymphatic drainage, where we're only wanting just a gentle stretch, I do about 20 to 30% on the skin. So for the patient, it's actually going to feel really light. The tape is designed to act like the properties of the skin. It's stretchy and warms up, and after a while, you probably won't even notice that it's on your skin. Okay. So same application for the inside part. Now, if you overlap the tape, and you'll discover this with some of the other techniques, unlike rigid tape, that tape likes to stick to tape, Gripit kinesiology tape actually likes to stick to skin. Oops, can someone mind pressing our lights again? So if you stick the tape to itself, it actually won't adhere. Okay, it'll stick a little bit, but if it's going to come off, that's the point, it will come off. So you want to make sure that you're not overlapping it. In fact, it's just next to it. And then the same application. So up to stretch across our medial gastroc, and then following along. That last part has no stretch, so give it a good rub to warm it up. Now, that might be enough just if we're trying to assist the calf to give it some support, but considering Alicia's come in and said she's got a calf strain, we're actually going to do what we call a decompression area for pain, okay? We all know if you end up with an injury, just gentle touch, basically activating your little pain receptors, can help with your pain, okay? Also lifting off the area, taking the pressure and the skin away from that area can also assist. So that's the reason behind the decompression strap, okay? So we find the area of maximum soreness, which for you we'll just say for today is here. You could do it just over that particular spot if you want to, or I'm going to actually extend it right across the full length of the calf there, just to really give that area lots of support. So, same application, you're rounding corners. That's it. Now, the backing paper on the Gripit kinesiology tape is terrible, so I'm folding this in half and tearing it so that you can peel back your edges, and suddenly you've got a really nice area to work with and adapt and play around. So again, unlike rigid tape, you can go around corners with this without your creases, and you can really stretch and turn, okay? So I'm going to apply, this is where I go up to about 80% stretch. We're trying to really gather that area. 80% stretch over the sorest spot, so she's still got some room to go. And then the last part just placed on the surface of the skin. Okay, I've just gone right around your calf there, and same on this side. Alright, we give it a good rub. Okay, come and have a stand there, Alicia, and see how that feels. Good. So just spin around for me. Now we actually had someone in Melbourne that did have a calf strain, and over a period of time they actually noticed they couldn't feel the tape, but they certainly noticed they were getting a little bit better heel off and push off by the end of the day. So it's the sort of thing that you can leave on for up to the week. So you could put this on for your patient, let them go with that for the week. Obviously you still manage their acute symptoms. This is an additional taping, and then you let them go from there.